Good evening, everyone. My name is Dr. Cheryl Lee. I am a practicing dentist in Washington, D.C., in actuality in the Northeast Brooklyn Catholic University area. I've been at my present location since 1990, and my drifter sister, Drifter Dana Long, asked me to do a video and talk about dentistry. So I will do that. It is my intent to speak slowly and clearly, but to not bore you. So, of course, Drifter Dana has given me several questions that she'd like answered, and so I will start with those. Her first question is, what is dentistry? Well, most of us think dentists deal with strictly the teeth, but there's so much more to the oral cavity than teeth. And in recent years, dentists have been referred to as oral physicians because we are very detailed and we understand that many ailments can be determined in the mouth, and we also know that different diseases from the mouth can cause problems in other major organs in the body. So that's why we are termed oral physicians. So dentists start with actually the face, and then we look for things associated with the lips. And then once we open the mouth, we look at the soft tissues that are in the mouth, the cheek area, and it's called mucosa. And then we look at the tongue because we know that oral cancer occurs on certain borders of the tongue, so we look for that. We also look at the back of the throat because lots of times you can tell if someone is a mouth breather just from looking at the conditions of the lips, looking at the dryness of the throat, and also it can look very, very constricted and very red. So we do lots of things. Also, what we look at the symmetry of the face, because sometimes when your nose is shifted to one side or another, that can also indicate that somebody has either an airway problem or a sleep problem. So dentists may be able to detect that before a patient even knows that they have a sleep problem. So we do lots of things in dentistry today. And then we look at the teeth and we look for diseases in the oral cavity. The two things that most people know about are cavities and gum disease. Grandma used to call it pyorrhea of the gums, but today we know it as periodontal disease or gum disease, which many patients have, but I just wanted to let you know that dentistry goes far beyond those two diseases. Her second question is, what are the education and licensing requirements for a dentist? Well, after high school, you go to a 4-year undergraduate college and earn a degree. Then I personally majored in biology, and then I had to take the dental admissions test and apply to dental school. Dental school was 4 years, and then I decided to do the pediatric residency following dental school, which was an additional 2 years. So where there's 4 years of undergrad, 4 years of dental school, and if you stop there, that's 8 years, and then you can go on out and go into private practice or work in a hospital or work for a clinic or do an associateship with an existing practice. But if you decide to go on and do a residency, like the pediatric residency was 2 additional years. But if you wanted to do oral surgery, that's an additional 4 years, which would be 10 to 12 years of total education in order to become a dentist. Now, as far as licensing is concerned, after you've completed the curriculum at a dental school, then you're required to take a national board examination. You do part of it during school, which is the didactic or the lecture part, and then after you graduate, then you're required to do a clinical exam. Certain procedures have to be done, and they have to clear you for that. And once you've passed, then you will receive your license. But of course, there is a fee for that. But once you've done all of that, it's pretty easy. And then you just need to pay for the license and keep it up. But I'll tell you this, because once you've finished all of that schooling, you have to renew your license every 2 years. And within that 2-year period, you have to take 25 hours of continuing education. So you're always in school, you're always studying so that you can keep up with all of the updated and current information to know about dentistry. Question number 3. How long have you been a dentist, and what made me interested in dentistry? Which are excellent questions, Drifter Dana. So I have been a dentist since 1983, so that would make it 37 years. 37 years as of May of 2020. Now with the 2 additional years, which when I finished in 1985, so I didn't actually start practicing until 1985. So that would make it 35 years in practice this year. I became interested in dentistry because my father was a dentist. His name was Dr. E. Preston Lee, and my father finished the Howard University College of Dentistry. And I don't know if I mentioned it, but I too graduated from the Howard University College of Dentistry. So my dad finished in 1952, I finished in 1983 and 1985, because I did my residency there also. So he inspired me to become a dentist. I thought what he did was incredible, how he could help people and help to make them feel better and to get them out of pain. And I knew that when I was little that I wanted to do something and help people. So my junior year in college, I decided that I wanted to go to dental school too. And the blessing was that I was able to do that. Question number 4. Are there dental specialties? Well, there are several, and I have them listed here because I don't want to forget any. So the first one is an endodontist. And an endodontist is a specialist who deals strictly with root canals. And most times when we say we're doing root canals, a patient may think that we're actually taking the root out of the mouth and doing something with it. But in fact, it's when a cavity reaches the nerve that causes your dental pain and possibly an abscess, when we have to go in and remove all the diseased tissue inside of the tooth so that you can keep the tooth instead of extracting it. So that's what an endodontist does. A geriatric dentist is a dentist who specializes in senior citizens. And you may not think that that's a specialty, but it takes a special kind of person to be able to treat the elderly. An oral and maxillofacial surgeon is the same thing as an oral surgeon. So they specialize. I'm hoping that this still is still taping. For some reason it cut off. So I was talking about an oral and maxillofacial surgeon, and the oral and maxillofacial surgeon is the same thing as an oral surgeon, and they do more than just impacted wisdom teeth, but they do reconstructive surgery on the face and the neck and just some amazing things, and they can also put patients to sleep. The orthodontist is the specialist who puts braces on our teeth and straightens our teeth. They either correct the spaces or they correct the crowding. Then you have the pediatric dentist, which I said that I did the residency for, and that's a specialist who treats children. And I think it's a very rewarding specialty for pediatrics and geriatrics. They're at the different ends of the spectrum, but they both take very, very special people to be able to deal with that population. You have the periodontist, and the periodontist deals with the gums around the teeth and the bone structure around the teeth. We need strong foundations, and which are the gums and the bones to support and house those teeth. And when the bone and the gum tissue are diseased, there's a likely chance that you will lose your teeth even when you don't have cavities. And you have the prosthodontist. The prosthodontist is the specialist who replaces teeth once they have been lost. So they replace teeth with implants, they replace teeth with dentures, they replace teeth with bridges. So that's what encompasses all of the specialists. Now, the thing about a general dentist is general dentists do all of that. We're trained to do all of that, and we do, but there are times when there are certain teeth and certain procedures that require a specialist, and that's when the general dentist will refer patients to those specialists to take care of the patient's needs. Are there dentists for animals? Well, believe it or not, veterinarians are trained to treat the teeth of animals. They have to sedate them, and they will clean their teeth and scale their teeth just like dentists do. The thing is I don't think animals, especially we're talking about dogs, I'm thinking dogs didn't have dental problems until they started eating food that humans consumed. As long as animals ate animal food, they didn't have a lot of problems with their teeth. But nowadays, dogs have calculus or tartar just like humans do, and they have gum disease and toothaches just like humans do. So that's just a little tidbit. Stop feeding your animals from the table. That's it on that. Why is dental insurance separate from medical insurance? Well, that's an excellent question. But if we had it our way, they would be combined, because what they've done is they've separated the mouth or the oral cavity from the rest of the body when it's all connected. It should all be billable under medical. Dental, they give us a cap. It may be either $1,000 or $1,500 a year, which doesn't allow us to do much. And a lot of patients want to just use their insurance when they need lots and lots of work, whereas you don't have a limit so much on medical. So the consumer needs to complain. Dentistry has been sort of placed on the back burner for years. So that's all I will say about the insurance. The seventh question was, do I have a private practice? And I do. I did mention that I first started with my dad in 1985, and I learned a lot from him. And then when my dad passed away in 1989, I continued on into private practice for myself. And I now have my practice at 1010 Quincy Street Northeast in Washington, D.C. Now, one thing that I'm very, very proud of is that I actually purchased the property in which I practice now. And I didn't see the real benefit of it then, but I'm so happy that I did now. Do you work with a team? Well, I have a staff. I'm not with a group practice. I'm a solo practitioner, and I have a receptionist. I have a financial coordinator. I have a hygienist and dental assistant. And actually, I have a couple of hygienists that are part-time. All right, so my telephone rang and I didn't know how to pause the video. So this is part 2 of this presentation. So I was talking about my practice and what my team was like. And I also talked about their roles. Well, not really. I told you who I had. Well, my receptionist is the first voice that a potential patient and existing patient hears. So it's very important to have a very special person who does that, because that voice is really the first reflection of me. And so it's very important that that person have a very pleasant voice and attitude, but they're responsible for scheduling patients. They're responsible for confirming patients and making sure that my schedule is full and productive, but also giving me enough time to be able to talk to my patients and get updates from them. But I'll tell you, since the COVID-19 pandemic, things have changed a lot. So I don't see the amount of patients that I used to see, because there has to be a cleanup time and a sanitation time and make sure everything is okay prior to the next patient being seated. So the receptionist does what I said. The financial coordinator is the person who goes over all finances and checks insurance for eligibility and maximum amounts that they have for the year, and also is the collector of funds for treatment. And then I have my dental assistant who assists me and sets up and assists me during all procedures, and she knows what's happening. She's also a scheduler for recalls and for after we've done treatment plans. And the dental hygienist is the person who does 6-month recalls on patients for their 6-month cleanings. They also do periodontal maintenance on patients. They also do scalings, but the doctor is the person who numbs the patient prior to that procedure. And they do have where they're teaching hygienists to do injections, but up until now, I don't have the experience of hygienists really knowing how to do that, or at least be comfortable and confident in doing that. So that's pretty much my team. Why is dental health important? Well, I talked about it earlier, because oral health is important for the overall health. And I don't know if you all are aware, I mentioned earlier about oral bacteria. Well, when they've done autopsies on patients, they found the oral bacteria to be lodged in the valves of the heart. They found oral bacteria to be found in the liver and the intestines and the pancreas. So oral bacteria can cause problems throughout the body. And that's why it's so important to maintain a healthy oral environment. We used to hear where people would say, well, a little bleeding of the gums is okay. But just think about it. Whenever you see bleeding, that means that there's an open vessel in your mouth. And that is the way that bacteria will enter into the rest of the body because it travels through the bloodstream. So bleeding of the gums is not healthy. And so I wanted to make sure I said that to you before I moved on. What are dental treatments? Well, as a patient comes into the dental office for the first time, I have to do a complete oral evaluation, and I talked about the initial, but when I get to the teeth and the gums, when I get to the teeth and the gums, I have to determine what types of problems the patient is having. So we do what's called a treatment plan, and I will go from the gums, and then we will go to the teeth and determine what necessary treatment each patient needs. So all treatment plans are different. Why do we take x-rays? Well, that's an important question, Drifter Dana, because a lot of patients don't want to have x-rays done these days. But the thing about x-rays now, because we do digital x-rays, it is such a low dosage of radiation that we can do the entire mouth with the amount of radiation that it probably took to take one x-ray of the traditional standard x-rays that we used to take. But we need x-rays because we can see the level of bone that's remaining in the jaw. We can also detect cavities that occur in between the teeth, and we can also see how deep cavities are that we have detected in the mouth with our explorers. So x-rays are most important in doing a complete evaluation of someone's mouth. There's also a machine called the Velscope, and the Velscope is a wonderful tool that we have because it can detect oral cancer way before an oral lesion appears in the mouth. So using that machine, we can help to treat a person and possibly prevent the spread and the progression of the cancerous lesion. So that's a tool. It's not an x-ray, but it's a tool that shines a particular light. So if there is cancer present, it will turn the tissue very, very dark. And it doesn't mean that the patient has cancer, but at least we know that there's something abnormal in the mouth, and then we can refer that patient to the oral surgeon for a biopsy. So what is a root canal? I mentioned earlier that an endodontist is the specialist who does root canals. And a lot of times patients think that we have to remove the tooth to take the root out of the mouth to do a treatment. But in actuality, when a cavity reaches the nerve and the patient feels pain, there can be pain, but there can also be an abscess that is forming, and that's because the cavity has contaminated the nerve tissue. And so a root canal is where we remove all of that diseased tissue out of the tooth and fill it with a material. But that treatment is a method in which we can save your teeth instead of extracting teeth, because there's nothing better than what God gave you. So saving teeth is an option, but once cavities have gone so far and reached the nerve, you only have two options: either do a root canal or extract the tooth. What is the difference between a bridge and a crown? Well, when you do a root canal, or when you've had a root canal done on a tooth, the tooth has actually lost its vitality. And because there's no blood supply and no nerve supply, the tooth can become brittle. So we have to protect that tooth, and we cover it with a crown or a cap. Both of those are the same. And that protective cap, well, they used to be made of gold, and now they are made of porcelain or ceramic. So that's the crown. Now the bridge is done. It's actually made of crowns, but just like a bridge connects two bodies of land that's separated by water, well, in the mouth, once you've lost a tooth, to replace the tooth, we would need to put a cap on the teeth on either side of that space. And then there is a crown that is not connected to the tooth in where that space is. And so we connect those two teeth and fill in that space between those two teeth. So that's what a bridge is. It's a set of crowns that are soldered together that will close up the space from teeth that you have possibly lost earlier in life. I hope that made sense. Why is the drill so loud? Well, I think the drill is loud because it is moving at such high revolutions. I don't remember how many revolutions per second, but it's moving very, very fast. And that's why we use certain drill bits, and we also use lots of water because of the quickness of the drill, it produces heat. So we need water in order to work on teeth so that we don't overheat teeth. So that's the only thing I could think of about the sound. I've been doing it so long, it doesn't sound that loud to me anymore. So those are the reasons, I think. How early should people start going to the dentist? Well, it's changed. When I started practicing and when I was in the pediatric program, children were supposed to come to the dentist at the age of 2, but now they want children to come to the dentist at least by the age of 1. And for very good reasons, because children have teeth. They start getting teeth at 6 months, but it doesn't mean that the child will be cooperative at 1. But we do our best to at least look at the teeth to make sure that they're not decaying. Now, years ago, and probably still even, we've been told not to put the child to bed with milk or juice because it causes milk bottle caries syndrome, where it'll rot out the teeth before the children even get all of their set of teeth, which is 20 teeth in the primary dentition. So it's still important. And say put the child, if the child needs a bottle to go to sleep, then it needs to be water. Now I know before they have teeth, then they need milk, they need mother's milk, and they need other milk if you're not nursing. But even once teeth come in, and if you are nursing, you still need to wipe the milk out of the mouth so that it's not pooled in there and just settling on the teeth. Why are people afraid to go to the dentist? Well, another excellent question. And most times, patients are usually afraid because they've had a terrible experience at an earlier time in their lives. And a lot of times it occurred when they were children. And that's why I appreciated completing the pediatric residency, because it gave me the opportunity to really work with children And when I was in school, you know, parents used to threaten their children that if they didn't behave, they'd take them to the dentist and have the dentist take all of their teeth out. Now, it seems strange for me even saying this now, but that really was done. And so by the time the child got to me, they were deathly afraid and really thought that I was there to harm them. But the one thing that I did tell parents was them coming to see me early in life, dentists that saw them later once they became adults really should thank pediatric dentists, because by the time they left our practices, they were perfect. They were the perfect patients. So usually those are the reasons why people are afraid. And I see lots of patients who are afraid on a daily basis. And usually when I ask them why, it's because they did not, they had a bad experience. And then as a result, by the time they come as an adult, things are usually really bad. And they only came to the dentist because they were in such pain that they couldn't take it anymore. What should new patients expect from their dentist? Excuse me. Well, they should expect compassion. They should expect someone who is listening to them and to take their concerns and put that in their treatment. Excuse me. Dana, sorry. I know you're going to have to edit. So, but you should be expecting the doctor to do the thorough examination, do the x-rays, and go over the recommendations for you. But also, the patient should give you time to be able to express your concerns and what it is that you're looking to have done. I'm not saying for you to go in and be dentist, but at least tell the dentist what brought you into the office that day. Okay? But then in return, you need to listen to the dentist and let's figure out a way to get your treatment done and completed. All right? Is there anything else that I would like for you to know? Well, I think most of these questions answer the majority of questions that you might have. But I will tell you this, because back in the 20s and 30s, there was a Pepsodent, which was the name of a toothpaste back then, years ago. And there was a jingle commercial about the toothpaste, and it talked about brush your teeth twice a day, visit your dentist twice a year. And that's how that started. And then insurance companies will only cover visits twice a year for cleanings. But I tell you, when you think about it, a lot can happen in 6 months, especially with cavities, especially with gums, and especially with lesions. So ideally, you really should visit your dentist 3 to 4 times a year. But I know there's an expense involved, but your health is most important. And so when there are diseases that are current, patients tend to want to visit more regularly. But when there is no problems, okay, maybe once every 6 months, but I would start getting in the habit of going to the dentist 3 to 4 times a year, and don't worry about what your insurance says, because your health is dependent upon it. I mean, we take care of our cars, we put high test gasoline in our cars, at least we used to, and we take our cars in for maintenance every 3 months for oil changes if we have to, or whatever they say. But we tend to not treat our bodies and our temples as they should be. And so, like I said, everything starts in the mouth, even what we put in it. And let me just say, we as humans like sugar, and sugar's not healthy for us. And we tend to want to eat fast foods, and that's not the best for us. And we really need to start looking at ways to keep our bodies healthy. And I have struggled with my weight for years, since I was little, since I can remember the pediatrician, putting me on amphetamines at 5 so that I could lose weight. And so that's been a real issue for me. But I still eat healthy. I need to exercise more, but you need to eat things with fiber and roughage to help, because even when you eat foods like that, it helps to clean your teeth and it helps to keep them strong. But when we eat lots of carbohydrates and soft foods and sugary drinks and sugary foods, it really begins to deteriorate not only the teeth, but also other organs in our bodies. And we know that African Americans top all diseases, and especially diabetes. And once we have diabetes, it's we have to really start taking care of ourselves, and we have to take some kind of insulin or diabetic medication to try to keep it under control. But when you first learn about diabetes, I just will tell you this: it can be reversed with diet, but it has to be something that you become very strict about. And I could talk on and on, but I know that I have taken up a lot of your time. I hope the information that I've given you tonight has been really, really helpful. And maybe, just maybe, Drifter Dana will have me come back to talk about some other things. Oh, but one last thing before I sign off. One thing that can help you with gum disease, well, not gum disease, but with the health of your gums, because you need to go to the dentist to treat that disease. But if your gums are healthy and you really want to keep it that way, first you need to floss. And it doesn't really matter. I prefer waxed floss, but you can either use waxed or unwaxed. But you should floss first and then brush. And you should always use a soft toothbrush. You should change your toothbrushes every 3 months. As soon as you start seeing those bristles starting to fray out, then you should change it. And then you could keep real inexpensive toothbrushes on hand, because if you become sick and catch a cold, then you should change your toothbrush every other day. Because we notice sometimes how you've been sick and you feel better, and then you have a relapse. A lot of times it comes from that toothbrush. So you should use that. You should also clean your tongue. There are tongue scrapers. You can use the toothbrush, but if you gag like me, then you should use a tongue scraper. And then the last thing that you can do, and it takes some getting used to, but you can do what's called oil pulling. And you can either use coconut oil or extra virgin olive oil. And just like you used to suck water through your teeth like this, you do the exact same thing with the oil, and it will pull the bacteria from up under your gums. You do it for 15 to 20 minutes, and after that, well, I would tell you to empty it out in a paper towel, because it's oil. I wouldn't spit it out in the sink or in the toilet, because you do not want to clog up your pipes. So I would empty it out in a paper towel and discard it into the trash can. But if you want to know more about that, I can do that at another time. But, and plus, my mouth is dry. I've said more than probably enough. And Drifter Dana, you may have to edit this, and prayerfully, I will figure out how to send it to you. So thank you for asking me. Thank you for indulging me. Thank you for listening. It's been my pleasure and honor to be able to speak to you today, tonight. And here's to your health. And with that, I will end with drinking water. And you all have a great, great night.